ankle sprain is usually caused by accidentally twisting or turning your ankle in an awkward way. Most of the time, the injury will resolve within a few weeks with the correct management and exercises. The ankle is a complex joint with the ability to hinge up and down, turn in and out, and rotate. The ankle gains its stability from the structural arrangement of the bones and from the ligaments that connect the bones together. A sprain occurs because one or more of these ligaments are overstretched and, in severe cases, torn. It's usually caused by a traumatic incident, such as a sudden change of direction while playing sport or a slip off the edge of a curb. Following an ankle sprain, it's very common to experience swelling and bruising. The bruising may track down your foot, so don't be alarmed if the injury appears to have affected more than just your ankle. Follow the acronym RICE. Rest, ice, compression, elevation. These techniques are particularly important in the first 48 to 72 hours. Avoid walking on your ankle too much in the first day or two. You may find using elbow crutches help in this initial phase. Inflammation is a normal response to injury. Place some ice wrapped in a damp towel over the swollen area for no longer than 20 minutes. It's important to check your ankle regularly, as ice can burn the skin. A simple tubey grip or ankle support can help to reduce the swelling in this initial phase. It will also give the joint stability while the ligaments are weakened. Please note, a support is not advisable to use long-term. Continual use of an ankle support will prevent the body's own stability mechanisms recovering. Resting with the foot above hip height is a good technique to help manage the symptoms of swelling. While medication is not usually needed longer term, you may find the use of oral non-steroidal anti-inflammatories or painkillers help to manage your symptoms in the first week. Following the first few days, it becomes important to stretch your ankle to prevent any long-term stiffness. The gradual addition of strength and balance exercises will help to regain stability around your joint. This will reduce the likelihood that subsequent injuries will occur. Your clinician will guide you through these specific exercises to ensure your rehabilitation is done at a steady rate with your recovery.
Start in a seated position with your legs straight. Invert your ankle by turning the sole of your foot towards the midline of the body. Do not move your knee or the hip to create this range of motion, move your ankle only. Sit down with your legs extended out straight. Start with your ankle in a neutral position and slowly evert your ankle by rotating the sole of your foot away from midline of the body. Do not move your knee or hip to create this range of motion, strictly move your ankle only. Start in a seated position with your legs out straight. Point your toes down as far as you can, and then back to neutral position. The knee stays straight during this exercise. Start in a seated position with your legs out straight. Pull your toes up towards your head, keeping the legs straight. The knee stays flat on the table as you move the foot up and down. Balance on your symptomatic leg for as long as you can. You may want to be close to a solid object to hold on to if needed. Do not rest your bent leg on the stance leg. In a standing position, step your affected leg back behind you. Keep the heel on the floor and the toes pointing forwards. Bend the front knee, moving your body forwards, until you feel a stretch in the back of the calf. Make sure your heel does not come off the floor and your back knee does not bend.